United Health for Women Empowerment seeks to improve maternal and child health in Afghanistan by enabling a collaborative and cooperative approach between academic institutions based in the U.S. and Afghanistan. Trained healthcare workers, professors, and public health students from UNC Chapel Hill, Duke, and NC State University will travel to the Medical Sciences University of Kabul in Afghanistan to create and implement curricula to train women as healthcare workers and midwives. This allows for a sustainable approach to improving maternal and child health conditions while also providing an opportunity for women, once contained to the domestic sphere, to contribute to societal development. According to the World Health Organization, the mortality rate of children under 5 years old in Afghanistan is 199 per 1,000 live births, as compared to the regional average of 72 and the world average of 60. The maternal mortality rate is a staggering 1,400 per 100,000 live births. This is among the highest rates in the world, with over 16,000 pregnancy-related deaths annually. The regional maternal mortality rate is 320, while the world average is 260. Many of the causes of death in children under the age of 5 are preventable and due to a lack of education, sanitation, and proper medical care. United Health for Women's Empowerment will help by training medical professionals at the Medical Sciences University of Kabul in appropriate prenatal, maternal, newborn, and child health. Students and professors from North Carolina State University, the University of North Carolina Chapel Hill, Duke University, and eventually other surrounding universities will travel to Kabul to train medical professionals at the Medical Sciences University of Kabul. Appropriate curriculum will be approved and continually updated through a committee of deans from participating universities. These medical professionals will in turn provide training, education, and medical supplies to women leaders in Afghani villages. These women leaders will remain active in their communities by providing much-needed education and medical care. By providing education, training, and medical supplies, the maternal and infant mortality rates will dramatically decrease. Also, a decrease in the under 5-year mortality rate is expected. Women and children in pastoral communities are even more susceptible to risks of death during childbirth and during the first 5 years of life. Many of these deaths are preventable with the presence of a trained birth attendant. Women face an additional adversity in their ability to receive health care as a result of being marginalized by their male counterparts, whom they are not allowed to travel without. This prevents them from traveling to health clinics to give birth. Thus, Afghanistan would benefit from the expansion of midwifery services. United Health for Women Empowerment seeks to promote the enlargement of these services by attracting women from all regions to ensure the communities most in need will receive the help. Through the training programs established by the project, women will be afforded educational programs and become specialized professionals who will gain social benefits and administer much-needed health care to Afghani communities. The projected total cost of United Health for Women Empowerment is $100,075, with most of the budget being allocated towards a mother-baby care package at $75,000, includes antenatal care, attendance on the day of birth by a skilled healthcare worker, postnatal care, a cesarean section if needed, emergency health care if needed, and medications for 500 women. The next is workshops and educational costs, which include training materials and medical supplies at $60,000. And finally, staff costs, which include training, travel expenses, transportation, housing, and food at $40,000. United Health for Women Empowerment allows for enormous social impact. By providing the underdeveloped Afghani provinces with the skills and resources to access to healthcare services, major social improvements will be made. The direct linkage of U.S. academic institutions with those based in Afghanistan will train women, especially those